The seventh order of the day is the second reading of the Customs, Excise, Tariff, etc. Consolidation Act, Amendment Bill 2025 SB 713. Distinguished senators will recall that the bill was read for the first time in this hallowed chamber on Tuesday, 18th February 2025. Mr. President, in the absence of Her Excellency Distinguished Senator Banigo Ikpalibo Hari, who is currently presiding over a public hearing outside the chamber, I would implore you to please invite most distinguished Senator Amos Yohana, representing Adamawa North, to move the motion for the bill to be read a second time.
Senator, distinguished colleagues, I am Amos Yohana. I represent Adamawa North. I rise to, on behalf of Senator Ipalibo Hari Banigo, representing Rivers West, to present the lead debate on a bill for an act to amend Section 21(3) of the Customs, Excise, Tariffs, etc. Consolidation Act 2025. Mr. President, distinguished senators, I rise today to lead the debate on a significant amendment to the Customs, Excise, Tariffs, etc. Consolidation Act, which passed its first reading on February 18, 2025. This amendment is not merely fiscal in nature. It is a public health investment strategy that aligns taxation policy with our national health priorities. It proposes a restructuring of existing excise duty on sugar-sweetened beverages, not to impose more burden on citizens, but to redirect part of the existing revenue to finance health-related programs and infrastructure that will improve the well-being of Nigerians. The rationale and objectives of the bill. The objectives of the bill are twofold: to strengthen public health financing by earmarking a portion of existing excise revenue on non-alcoholic, carbonated, and sweetened beverages for preventive health programs and primary healthcare infrastructure, and to sustain national efforts in addressing the growing burden of non-communicable diseases such as diabetes, obesity, hypertension, and cardiovascular diseases that are increasingly linked to unhealthy dietary habits and excessive sugar consumption. Mr. President, distinguished colleagues, the link between excessive sugar consumption and the rising prevalence of NCDs is well established. It is estimated that NCDs now contribute over 30% of annual deaths in Nigeria. These are largely preventable diseases that can be reduced through health education, lifestyle modification, and strengthened primary healthcare delivery. Unfortunately, public funding for health remains inadequate. It has been over 2 decades since the Abuja Declaration, where African Union member states pledged to allocate 15% of their annual budgets to health. Nigeria is yet to meet this target. With declining donor support, and a mass exodus of healthcare professionals, there is an urgent need to innovate within existing fiscal frameworks to generate sustainable domestic financing for health. The gap and why this amendment is necessary. Current fiscal legislation provides several earmarked levies for national development. Tertiary Education Trust Fund, 50%. Nigerian Education Loan Fund, 15%. National Information Technology Development Fund, 8%. National Agency for Science and Engineering Infrastructure, 8%. National Board for Technological Incubation, 4%. Defense and Security Infrastructure Fund, 10%. And National Cyber Security Fund. However, public health is conspicuously missing from this structure, despite being a key pillar of sustainable development. This bill therefore seeks to integrate health as a beneficiary of existing excise revenue, particularly from products known to contribute to health risk, benefits, and expected impact. By earmarking part of the excise collected from SSBs and similar products to a dedicated fund of health, this amendment will provide sustainable domestic funding for preventive health programs, strengthen primary healthcare systems, especially at community levels, support nutrition and wellness education across schools and workplaces, facilitate early screening and detection of NCDs, and improve the overall health security of the nation. Evidence from other countries, including South Africa, Mexico, and the United Kingdom, shows that linking excise revenue health outcomes not only improves fiscal efficiency, but also encourages industry innovation and healthier consumer behavior. This approach will make Nigeria's tax framework smarter, more purposeful, and people-centered, ensuring that every naira collected from health risk products directly contributes to protecting and improving public health. In conclusion, Mr. President, distinguished colleagues, this bill is not about introducing a new tax rates. Rather, it is about putting existing revenues to better use in a way that directly benefits the health and productivity of Nigerians. By earmarking excise proceeds for health, we can transform fiscal policy into a powerful tool for disease prevention, health promotion, and human capital development. I therefore urge my distinguished colleagues to support this bill for second reading and to allow it to be referred to the relevant committee for further legislative action.
Senator Abdul Ahmed Ningi will have the floor, then Senator